Okay, this is Jessica,
And this is Megan.
and we're talking about spatial retrieval and memory. So, what is spatial retrieval? It's a memory training strategy that is used to help people with memory impairment learn, maintain, and recall functional information by targeting implicit memory systems. A clinician will verbally rehearse the response to a lead question over expanding time intervals versus short, intensive sessions. The trial sessions will depend on the severity of the individual's memory loss. What is retrieval practice? The act of retrieval from long-term memory. And what is the spacing effect? Using repeating training opportunities for individual items over a given amount of time, preferred to more intensive short-term therapy treatment. So the GDS is the Global Deterioration Scale. And before we can really get into spatial retrieval, we must be able to rate the severity of the cognitive impairment before treatment. The GDF also helps us set realistic goals for the patient, family, and the therapist as well. So it's argued that this stage is between 3 and 4 on the GDS, which is a mild to moderate decline patient. That's when we really start to see the need for spatial retrieval. And some tips to use when for these kind of these mild to moderate clients, is set simple goals for client, review the beginning, middle, and end of an activity or goal, and demonstrate the steps first. Keep a structured setting, which means every session should have similar activity times for the patient, so the patient isn't confused, because these patients have severe cognitive impairments, so they need structure. And also encourage the client not to be scared to ask for help. We also want to use reassure versus reasoning with the client, and instead of arguing or deciphering with the client, we can reassure the client that what they're doing is, when they're doing the right thing, we want to reassure them. And communication should be meaningful to the client. We want functionality should be an important part. So dementia and memory, and we know dementia patients have difficulty understanding and learning and storing new information. They also have trouble accessing basic functional information. Reading remains fairly intact, so we want to remember when retrieving memory to use this to our advantage with dementia patients. Compensatory efforts are better for patients not suffering from memory loss. So we're going to stray away from compensatory efforts with our dementia patients. We're going to use these more with Parkinson's and ALS patients. And we're also going to use external memory aids for dementia patients. And here we have a list of what kinds of items that could be: signs, picture cards, memory books, recall memories, and independence in activities of daily living. The study currently done on dementia and spatial retrieval was done with a comorbidity of dementia and dysphagia patients. Self-eating times has been decreased when using spatial retrieval memory based on this study. In the current study, we had 4 men and 1 woman, all with dysphagia and dementia from ages 65 to 99, set in nursing homes. The setting used was a quiet room, either isolated in a bedroom, an activity room, home, or living room. And during the procedure, there was a trained response visual on a yellow index card that read, "I eat and drink safely." And the treatment that was given was over 30 to 45 minute intervals for 5 times every week. And the visual aid was not used during the baseline session, but there was a visual aid used on the next sessions. So for treatment, we're going to talk about the steps in this study and what you can use during treatment with spatial retrieval in dementia patients. So first, the clinician needs to give the question and the response to the patient. So in this book, forgot to mention this book right here, Spatial Retrieval Step by Step, is a really good tool by the author of our article that would be useful when working with these patients. She really breaks down each step for using spatial retrieval with dementia patients. And she talks about identifying the need, developing the lead question, and formulating a response. So first, to identify the need, we have to give a question and a response to the client. So this example would be, you'd ask the client, what do you need after you take a bite? And if the client doesn't respond immediately, the clinician would say, I take a drink. And then they might also list some other responses as well, such as I clean my mouth with my finger, or I tuck my chin and swallow, if they're trying to teach multiple responses to the patient. And then next, the clinician will use a visual aid. So the clinician, and this would be over different intervals of, in this study, they did 5 seconds, 10 seconds, 20 seconds, 40 seconds, a minute, 2 minutes, 4 minutes, 8 minutes, and 16-minute intervals. So you do take breaks in between these training procedures. And so, again, in step 2, the clinician would say, show me how you eat and drink safely. And the visual aid would be by the patient, so they could look at the visual aid and say, I eat and drink safely. And then the clinician, after that training is done, the clinician will then train the patient with the expected response. So by this point, the patient should be able to formulate a response on their own. So the question would be, today we are going to practice remembering to take a drink after you take a bite. This card tells you what to do. What do you do every time after you take a bite? And hopefully the patient will say, I take a drink. But if the response is incorrect, then first the clinician will go back and correct the response by saying it immediately, as in step 1. And then the patient will repeat the given response. And then the time until the next test trial would be reduced to the most successful time period. So if the time they were working on between question and response was 4 minutes and the patient produced it incorrectly, it would go back to 2 minutes.
So another study that we did on dementia and Alzheimer's was based on positive effects on learning semantic information. And the study was done on 12 studies that was analyzed. And several of them were effects of dementia diagnosis and severity on the performance of spatial retrieval therapy in the participants. There was a lot of different disorders, and 208 participants had dementia, 193 had Alzheimer's, 7 had vascular dementia, 3 had mixed dementia, and 5 had probable dementia. And from the 12 studies, 7 of them had the sex of the participants, which 30 participants were male, and 72% or 72 people were female. And out of the 12 studies, 5 studies reported iteration of the participants, and iteration means that there was a death of a participant, which is not uncommon in this population because unfortunately dementia does happen at the end of life. And there was a variety of different settings, and these studies were characterized by level 1 and level 2 based on the evidence according to the ASHA adopted standards, and it's called the ASHA level of evidence chart, which we'll look at in just 1 second. And there's different protocols that deal with the space retrieval therapy, and that is intervals expanded with correct responses but did not retract with incorrect responses. And the most common intervals that were done in this therapy were intervals of 0, 30 seconds, 1 minute, 2 minutes, 4 minutes, 8 minutes, 16 minutes, and etc. So they do it in like intervals. And the treatment was given 12 to 30 minute sessions 4 times a week. And so this is the evidence-based. So this is the evidence-based chart, and most of these articles were from level 1 and level 2, and 11 out of the 12 were level 2. So that means that it was controlled study without randomization, and well-designed quasi-experimental studies. And so, for example, in this study, there was a lot of cognitive assessments done, and all studies provided a measure of severity of the dementia that was given, or Alzheimer's. And so the mini mental state examination was one of them, which I'll be talking about in just a sec. And then there was the clinical dementia rating, and that is a 5-point scale used to characterize 6 domains of cognitive and functional performance. And that includes memory, orientation, judgment, problem solving, community affairs, home, hobbies, and personal care. And Jessica already talked about the global deterioration scale and how that was important. And all the studies were also divided into mild, moderate, and severe stages, which is important to categorize each study. And in this study, there was a large number of participants with mild dementia. So with this is the mini mental state examination. And so there's a total score of 30, and 24 out of 30 indicates normal cognition, but anything less than 24 means a cognitive impairment. So you can see that the questions are like, what is the year? What is the season? So it's just basic questions. And treatment that the study did say, they suggest for implementing spatial retrieval therapy in practice settings, and always, but we always want to consider the individual when giving this type of therapy. For example, the severity of the dementia may affect outcomes, and what like naming, and what you can do with that therapy. And we want to suggest to optimize success of this therapy by limiting target information, chunking strategies, providing corrective feedback, and maintaining that information, which we do want to do booster sessions every 2 to 6 weeks. And booster sessions mean follow-up support to maintain these strategies. But it's also important for caregivers to get trained in spatial retrieval therapy. We don't know how long that takes. That's what the study said. But it does increase the quality of life of that patient.
So lastly, we have aphasia and space retrieval, which had a very similar procedure as the dementia procedure that we went over earlier. There were 4 left hemisphere stroke aphasia patients, 2 men, 2 women, and they were asked by researchers to select the name for a picture out of 5 written cards. And they were mainly focusing on pronouns in this study because there hasn't really been a lot of memory retrieval for pronouns. So The trial was followed by a prompt, do you recognize this person or thing? And they'd be shown a set of pictures. I think they focused on celebrities in this study. And there'd be a scoring chart based on how many celebrities they could name after the set of retrieval steps that they went through so they had identified the question, develop a lead, and they'd have to formulate a response on, I think it was 5 celebrities for the retrieval. And so the results again showed that spatial retrieval practice, in this case, repetition of the target name, was more effective than errorless learning treatment and massed intensive training. So, and these are our sources.